Now, if you've ever hung out in a karaoke bar or a dance club, or just remember the disco era of the 70s, then you definitely know disco diva Gloria Gaynor. Gloria won her Grammy in 1980, and she has a new album coming out this year. In fact, she has struggled with osteoarthritis that nearly crippled her for years. Take a look.
La, la. I suffer with osteoarthritis. It affects me mentally because I know that I can't do the things that I used to do. The pain is excruciating, debilitating. It makes you feel older than you are. In the beginning, I started feeling pain in my knees, like pins and needles. I would avoid stairs like the plague. Eventually, I had to go and seek medical help for it. The doctor said, it's osteoarthritis. You will have to have your knees replaced. This one was done twice. So now I have 2 titanium knees. To finally have the surgery on my knees was the best thing I could have done. Going up and down stairs is still painful to an extent, nothing like it was before. I'm living with osteoarthritis, emphasis on living. The words, oh no, not I will survive. I feel that I survived osteoarthritis and I would not let it stop me.
Well, joining me to talk about osteoarthritis is my really good longtime friend, Pfizer's Chief Patient Officer, Dr. Freda Lewis-Hall. So welcome. And additionally, please welcome Grammy Award-winning Miss Gloria Gaynor. Well, Gloria, it's so good to see you. Thank you so much for being here to talk about how you continue to survive living with this osteoarthritis. Now, you were actually recovering from a horrible fall when you received the song, I Will Survive, right?
Right.
Now, you had that fall in 1978, but you were diagnosed with osteoarthritis in both knees in 1985, right?
Yeah.
And then also in your spine 12 years later.
Listen, I will survive for certain. With 12 rods in my back, I'm feeling great and I'm good to go.
So Dr. Freda, tell everybody so they know, what exactly is osteoarthritis? How common is it?
Osteoarthritis is a form of degenerative joint disease, and it is the most common form of arthritis that we see. And we often refer to it as OA. Osteoarthritis occurs when the cartilage, that flexible tissue that covers and protects bones to prevent them from rubbing against each other, becomes damaged or deteriorated. And again, we don't know exactly the cause, and it can develop gradually over time as people age.
Well, other than getting older, are there other risk factors associated with developing osteoarthritis?
Other risk factors include joint damage or joint injury or overuse, and this can be related to sports or to repetitive physical labor. The other is obesity and weight gain. That increased weight puts greater pressure on joints, particularly those knees. And another risk factor is genetics. And last but not least is gender. Over the age of 55, it's more common in women.
For someone like Gloria, who's already living with the disease, what can they do to ease the pain, to ease the discomfort?
First, healthy diet and healthy body weight, as well as routine, moderate exercise. These can help perhaps slow down the development of the disease. As for treatments, there are a range of treatment options, and your healthcare team seems to have really worked hard with you because they can help sort through the options. But the options to help manage symptoms can include things like physical therapy, pain and anti-inflammatory medications, assistive devices, and then of course, in very severe cases like yours, surgery can become necessary.
Does your osteoarthritis give you problems? Is it worse sometimes more than others?
Well, on cold days or rainy days, it affects your joints. But, you know, music is my life. I'm not about to let osteoarthritis stop me or even slow me down. I do the things that you suggest. I exercise, I do my physical therapy.
And I think you've proven a further point, which is with the right care and the right attitude, you can not only survive, but you can thrive.
Absolutely.
Yeah, for sure. If you or someone you know has osteoarthritis, you can go to gethealthystayhealthy.com, and there's so much information there about OA. So gethealthystayhealthy.com is where you want to go.
And of course, while you're there, you can sign up for a monthly newsletter.
I want to thank all of my guests today, and especially Dr. Freda Lewis-Hall and Gloria Gaynor.